Hello and welcome, everyone. Thank you for joining us. I'm Molly Pelosi. I'm a Senior Product Marketing Manager here at Hyro, and I will be your moderator for today's discussion. Before we get started, I just wanted to go through a few housekeeping notes. Today's session is being recorded, and everyone who registered will receive the recording by email. Throughout the conversation, please feel free to submit your questions using the chat feature. We'll save some time toward the tail end of the discussion to answer as many of your questions as we can. Today's conversation is really about resilience. FQHCs and rural health providers have always been asked to do more with less. But today's rapidly evolving funding and policy landscape has created an entirely new level of pressure. Organizations are being challenged to protect revenue, expand access, improve patient outcomes, all while operating with constrained resources and helping patients navigate constant change. We're joined by leaders from Spectrum Health Services and Tanner Health who are navigating these challenges firsthand, along with experts from WebMD Ignite and Hyro who are helping safety net providers strengthen patient engagement, improve health outcomes, and protect revenue through innovation. Before we dive in, I just quickly wanted to walk through today's agenda so you all know what to expect. We'll start with brief introductions to our panelists and then spend a few minutes setting the stage, looking at pressures FQHCs and rural health providers are facing today and why patient engagement has become such a critical lever for both access and financial resilience. From there, we'll get into the heart of the discussion, how organizations are using proactive outreach to close care gaps, reduce no-shows, improve re-enrollment, and protect revenue without having to solve every challenge by hiring more people. And we'll also give you a first look at what WebMD Ignite and Hyro are building together, combining clinically validated patient education with AI-powered engagement to help patients reach the right next step at the right time. And after that, we'll hear directly from our panelists as they share practical lessons, strategies, and real-world examples that can help others learn and grow. And finally, we'll leave plenty of time, as I mentioned, for your questions. And with that, let's get started by meeting our panelists. Eric, let's start with you. Can you introduce yourself and tell us a bit about your role at Spectrum Health Services?
Sure. Hello, everyone. I'm Eric Rios. I'm the Chief Information Officer here at Spectrum Health, located in Philadelphia. We have about 4 health centers, see about actively 22,000 patients, unique patients, that is. We do all the services from medical behavioral health, dental, OBGYN services, podiatry, pharmacy. We do everything that a hospital does, but just for outpatient services, right? So that's who we are. And we've been in business for next year will be 60 years.
Wow. All right. Well, thank you, Eric. And T, let's come to you next.
Thanks, Molly. I'm T. Ogletree. I'm the Executive Director of Population Health and Innovation at Tanner Health. We serve communities in West Georgia, East Alabama. We're headquartered in Carrollton, Georgia, about 40 miles southwest of Atlanta. My work really sits at the intersection of patient access, clinical operations, pop health, and technology. So, I'm excited to share what we've learning as we implement these tools, in real world practice environments. Tanner Health is 5 hospital health system. We have 40 medical group practices, 7 of which are designated as rural health centers. And so we often deal with the same challenges that as FQHCs do as well. So looking forward to the conversation. Thank you, Molly.
Yeah, thank you. Amy, over to you.
Yeah, thanks, Molly. Nice to meet everyone. Thank you for attending. I'm Amy Rainford with WebMD Ignite. I'm Senior Director of Strategic Partnerships. And WebMD Ignite is the #1 company that provides patient education and patient engagement services. And we are very excited to talk about this new world of rural health transformation.
All right. And then finally, Sindhu.
Thanks, Molly, and thank you all for joining. And it's a pleasure to join all of you today for this conversation. My name is Sindhu Pandit. I am a physician, a physical medicine and rehab physician, focused on healthcare strategy, digital transformation. I do still practice, and I'm based in New Orleans. I've also spent time at enterprise organizations looking at how technology can up-level the work clinical teams are doing, as well as how patients can be served better to live well. And I'm privileged now to have joined Hyro as the VP of Clinical Product Strategy. And I also sit on the board for Louisiana Public Health Institute, looking at and supporting our teams as they work in population health, as well as clinical partnerships and other things to support the region as a whole.
Thank you all. And thank you again for joining as our panelists. I'm really excited for today's conversation. All right, so before we jump into AI and automation, I think it's important for us to level set on today's environment that our safety net organizations are operating in. On the one hand, we are seeing a significant investment in rural healthcare through the new Rural Health Transformation Program, which will provide $50 billion over the next 5 years. And at the same time, organizations are preparing for more than $900 billion in Medicaid funding reductions over the next decade. And to that, the lasting impact of Medicaid unwinding, with roughly 27 million people being disenrolled, along with ongoing workforce shortages, and the reality that more than 100 rural health hospitals have closed over the past decade, with 1 in 3 now at risk of closing. This is an incredibly dynamic environment. Organizations aren't just responding to one challenge, they're navigating multiple pressures at once. So I'd love to start with the people who are living this every day. Eric, please walk us through how your organization is actually responding to these funding shifts and what's changed in how you're operating. Eric, let's start with you.
Yeah, so the big thing for us is Medicaid, right? So 70% of our patients who we see today are Medicaid. And the challenge is those users are losing their Medicaid insurance. So that all of a sudden, that Medicaid patient who we would have received, for example, a payment of $300 and change, now it becomes a self-pay, which could potentially become $50, right? So the loss of that revenue is going to be really impact with us. But with technologies today to help us with recertifying those patients is going to be what we need to do to pivot to make sure we can get those folks stay on Medicaid.
Yeah, and T, I would love to hear from you as well.
Well, and to kind of play off of what Eric was, mentioning about the issues with the coverage, healthcare organizations are ultimately being challenged to do more with resources that we already have. So for us, access has really become a strategic priority. If patients can't get through, they can't get scheduled, don't know what to do next, outcomes are ultimately going to suffer. So we're really focusing on trying to create more capacity, improve efficiencies, and trying to really help our teams spend more time on the work that truly requires, a human's touch. What we're finding is, as we kind of tighten our belts, is we can't hire our way out of every challenge. We have to look at ways to build smarter systems that are going to help our teams focus on the work that, only we can do. So.
Yeah, I love that you mentioned prioritizing patient access. When you look at your resources and your time, has there been anything in particular that has moved to the top of the list in terms of a priority? For example, prioritizing technology to help with time and resources, and to emphasize the needs there.
Well, Molly, for me, access means a lot of different things. And, we have to look at it from the standpoint of how are the patients interfacing and working with and communicating with, their care team, the health system, their primary care provider, their specialists that they're working with. We have all of these wonderful resources and these wonderful tools and these great programs to support chronic conditions and all of that. But, how the hardest part to me is, how do you get the patient really invested in their own health care and wanting to move forward and change their lifestyle and be educated and understand, not just be told, hey, you're going to have to eat healthier, but actually supplying the patient with the knowledge that they need to understand what their conditions are and how are they going to support themselves and to live a healthier, happier life. And I think part of that is through interfacing with technology. You know, it brings it to the patient's forefront, right? Their smartphone, their devices that they're working with, they're able to easily keep up now with, you know, appointments and medications and refills and communicating with care teams. And so I think, you know, the technology has brought a lot of wonderful positive benefits. One of those being it directly brings the patient into the center focal point of managing their own care, if that makes sense.
Yeah, absolutely.
And I just want to add to what Tia was saying, you know, the fact that technology is the tool that's going to help the patient, right? So we have learned recently, people always say, well, FQHC patients, you know, they don't have smartphones or they don't have this. And that's totally incorrect. You know, we're utilizing technology to outreach to these patients and they want control. They want to have the ability to say, you know what, here, I got a text or I got to, you know, I can pick my time, I can pick my date, I can do all this. I don't have to worry about calling, waiting on hold. I can do this on a Sunday afternoon. You know, given the ability and that access back to the patient, giving them control means a lot to them. And we start to see better numbers because of that.
Yeah, that's fantastic. Sindhu, from a clinical perspective, when you look at these populations that these organizations serve, many of whom face real barriers to understanding their care options and coverage, how does health literacy factor into outcomes in communities like these?
Yeah, I mean, I just need to build on the comments that have already been shared. When I was primarily clinical, I spent time at health systems that served these populations in Houston and in the Bronx and West Side of Chicago. And I think it's been said that you can't, you know, paint this population with a broad brush and say it's all one size fits all. No one has access to this or that, or they don't want this or that. And the idea is that I think T said it, that you have to think about the patient being in the center, and that's truly how we need to design the system. So when I think about health literacy specifically, it's the hidden variable in all of these numbers. It's really difficult to ascertain where your patient population stands with regards to literacy, with regards to coverage, literacy with regards to disease state, literacy with regards to, you know, the different treatment plan that's ahead of them. But the other component here is that many of them are, much like other populations, are also caregivers. You have children in the family that they're taking care of, older individuals that they're taking care of, so multi-generational units. So when I think about health literacy specifically, I think about it as allowing for you to open the door to living well for these populations and making sure we're delivering information in a manner that can be not just understood, but acted upon. And that action is where I think technology can really, really help and kind of bridge a gap. You know, I think about 27 million disenrolled. Many didn't even know they were disenrolled until they were accessing care. So how do we get ahead of some of these conversations and prepare patients for where they are in kind of managing that road to living well? So when I think about like AI agents can support that patient calling in at 9 p.m. after their night shift, who is opening their mail when they got home and they're not sure how to understand the letter about their coverage. And that's the reality. That's where I think technology can lean in and support the clinical teams trying to do the work in, you know, supporting the healthcare needs of these patients.
That's fantastic. And Amy, I'd love to hear from you across the organizations that you work with. Are you seeing health literacy and patient education erode as funding pressures mount? And what's the cost of that when it goes unaddressed?
Yeah, thanks, Molly. Just to tag on to what everybody is saying, health literacy is so important. And I wouldn't say we're seeing it erode. I think if anything, now we have just so many, there's so much information out there. We know that patient and consumers alike are turning to AI. They're turning to, I won't name some of the top chat agents anymore, but they're turning to AI. It's very similar to what we saw when a certain large search engine became mainstream. The patients are able to find health education, but what we hear from providers as well is not only do they want their patients educated, but they want to make sure that they're finding evidence-based, clinically reviewed, well thought out education that's not hallucinated, that they can trust that their patients are going to come into them with already some information on their conditions and their health journey. And that's where WebMD comes in, is we really want to work with technology vendors and anybody who's trying to think outside the box and reach patients where they are with validated clinical education. We know the cost of misinformation from the last few years. So it's very important for patients to not only understand their coverage, but understand their conditions and their health journey.
Yeah, that's fantastic. So one of the themes that we've touched on is that patient engagement isn't a single interaction. It's an ongoing journey. And patients have questions before they schedule, before they arrive, after they leave, everywhere in between. As a result, organizations are thinking beyond automating individual workflows and instead thinking about how they can support patients across the entire care journey, from providing care to scheduling appointments to pre-visit prep, billing, and follow-up. So that's exactly where Hiro's AI agents come in across voice, chat, and SMS, helping organizations like Spectrum and Tanner automate these high-volume interactions. The goal isn't simply to automate a task. It's to create a connected patient experience. So T and Eric, you both have deployed Hiro's AI agents within the past year to manage patient interactions at scale. Can you walk us through what you've implemented thus far, what your AI agents are handling today, maybe what's on the roadmap, and any early results that you'd like to share? T, if it's okay, we'd love to start with you.
Sure. We went live with our first practice back in April of this year, so we're still kind of newbies to Hiro. We started out in our primary care practices, and we're just working our way through one by one. So, as it stands today, we've got 3 primary care practices that are live with the voice agent. So if you call the practice, our AI, her name is Clara. We've named her affectionately here at Tanner Health. She answers the phone and she informs the patient, thank you for calling X department. I'm able to answer a number of questions related to your appointments, my chart questions, and those sorts of things. How can I help you today? And so essentially we kind of have that's the kind of the base layer of functionality, right? And then you build upon that. But preliminary results we've seen, we've had roughly 30,000 phone calls since go live across now the 6 practices that we have live. And around 25% of those calls, maybe a little bit less, are being handled before they ever even get to one of our registration staff members. So that means that the simple questions like, what is your fax number? Can we get directions? What are your hours of operation? Those are all very easily answered by Clara. Hey, I'm locked out of my my chart account. Can you help me with that? Sure, we can text you a link if that's okay. That'll direct you to the self-help page, and then eventually get you to someone that can help if it's something more complicated that can't be solved in that manner. I am excited to say that today we went live across our primary care practices with the ability for them patients to be able to actually direct schedule themselves. So if they have an established relationship with a provider in the practice, Claire is going to help you find the nearest appointment, the soonest appointment, get you on the schedule. And so now, those calls are also starting to be, captured or resolved before they ever make it to an agent. So, we run a lean team here, and we've got multiple, we've got a lot of different priorities on every team member's plate. So you may be a registration staff member, you're checking in patients and scanning IDs and insurance cards and taking maybe a copay payment or whatever it may be, but you're also answering the phone. And so Clara allows you to focus on where a human's touch is needed, where you need that face-to-face interaction, or where you need more complex thought or a more complex process where you're trying to transcribe referrals as they're coming in and those sorts of things. So it's really been a huge benefit not only to the patients but also to our staff members.
That's fantastic. And Eric, love to hear from you as well.
Yeah, so just jumping off of what T was stating, we're a little further ahead in the sense that we've been through this implementation. We're almost at a year point where we did implement many features, and our AI agent, her name is Ria. You call us today, 24/7. Ria answers the phone. Currently we are reschedule, cancel, confirm. She will take your call. She'll be able to triage to the pharmacy. She'll be able to, just like T was mentioning, send you fax information, send you the address, text it to your phone, do everything that an agent would do. But now she is virtual and she's available, like I stated, 24/7. We found that it's been a huge benefit for our patients to be able to reach Ria on the first ring. As we all know, with call centers waiting on hold, waiting for a queue callback, there's it's a lot for a patient to have to go through. So with us implementing Ria, we were given the customer experience back to the patient and seeing those results from a customer service satisfaction, that patients do love that ability. We are currently testing what T has just implemented just recently with new appointments, so that the patient would be able to call with their regular appointment, be aligned with their provider, with their site, where they have their appointment done. But to have that ability to, again, reach out to us at any time has been an enormous benefit for us. We're seeing on average about 20,000 calls a month. So we're not as high as T, of course, but we're seeing about a 70 to 75% completion rate, all by Ria. Prior to moving to this virtual agent with Hyro, we were having a third party answer all our medical appointments, and the cost on that was dramatic, right? So you outsource that. By us implementing Hyro, we're saving 60 to 70% on what we were paying in the past year. So it's an incredible savings for us. But on the other side, for the patient, it's giving them an excellent customer experience. When it's all said and done, that's really what it comes down to.
Yeah, that's fantastic. I think you touched on this a bit, but just wanted to ask this question just in case you have anything to add. As you think about protecting revenue in today's funding environment, what role does AI play in that strategy?
Yeah, so just like I mentioned earlier, that alone, that savings for us, we're talking hundreds of thousands of dollars, right? And so we have a very lean budget, of course, and we're anticipating it to even drop even further come January 2027, where we really start to see those Medicaid cuts. So for us to be able to find those dollars that we can save, and yes, there are some resources because we have to be leaner, so allow the technology to be able to do that work for us where it was done by a person. Will the use of human interaction go away? No, that'll never happen. There'll always still need to be that sort of touch point, but instead of us using that from an external standpoint, we'll use that internally and be able to, again, save those dollars for us. And that's just a little piece, but that savings alone was enormous for Spectrum.
That's great. Sindhu, from a clinical perspective, what's the downstream impact when patients miss a preventative screening or fall out of care? And what are organizations really losing when engagement breaks down?
Yeah, there's been so much wonderful anecdotes shared by Eric and T. I've got to build on that. A missed screening or a care gap that didn't get closed. It's not that in that moment you actually see it. It's probably on a spreadsheet or something, but it resurfaces maybe in the ED, maybe a diagnosis that's progressed, and then the cost, and I don't mean dollars only, I mean to that person, to their life, to their family, is so much more. If we could have just caught it earlier or acted upon it earlier or allowed for conversations to start sooner. And everything that was said about Clara and Ria, we have to start thinking about them as extensions of ourselves, because the trust that we need to build with the patients we serve, they don't happen only in that big critical moment in that clinic visit. It's all these small touch points that kind of allow for that trust to get built. And a confusing, disconnected experience can break that trust so quickly, and it's very difficult to regain that back. So if we're able to leverage tools that are available widespread to us and very well used upon in other industries, if we can use those tools like just demonstrated in the conversation, in the comments prior, you can really start to build on that trust, that relationship, and start to build a relationship for that individual to think of themselves as, okay, I can go, or think of, the organization as a place to come to when those questions arise, or when something is surfaced for them to act upon, to consider acting upon it. Because again, these are individuals. They can make decisions to participate, to own, to take control of their care. And that's what we want. We're not dictating, kind of what these steps are. But as so beautifully stated in the comments before, by having these tools kind of surface these things up in a proactive manner, we're flipping these conversations from being reactive to preventative. And then you can kind of surface up those that need human handholding for those clinicians to have that experience with that patient, but also have that time back so that they can have a deeper conversation about the questions that patient has. And again, I keep coming back to trust. I think that's really what this is. I mean, we all want our patients to have the right roadmap to their health, to live well. And I think these tools are widely available, and we can now leverage them to help our clinical teams do just that.
And Molly, if you don't mind jumping in just real quick, Sindhu
Yeah.
makes an excellent point, and I truly believe in this word is trust. The fact that our patients trust us. So if we go ahead and we implement these tools to enhance their experience, to give them the access, they trust us that we are doing the right thing for them. So trust is huge. So if they see us doing these things, implementing RIA, for example, or any sort of care campaigns or the things that we are doing, we chose it to better enhance the patients because they trust us, more importantly.
That's amazing. Thank you both so much. That was really incredible. Amy, patient engagement and education, and it's all at the core of WebMD Ignite's work. Where do you see the greatest opportunity for healthcare organizations to improve patient outcomes while also protecting revenue through smarter, more personalized outreach?
Yeah, I just want to hit on what Sindhu and Eric just said, trust. Organizations want trust. Organizations want to build trust in their communities. And I love, Sindhu, when you said roadmap, roadmap to health, that's where WebMD comes in. We help patients build their roadmap to health. We educate them. We engage with them. WebMD can start engaging with consumers and patients earlier in their journey. We can help organizations develop outreach campaigns that actually meet the patient where they are and educate the patient on the thing, the service, the RIA, the Claire, whatever can help educate the patients on all the things and all the services that can help their healthcare journey by working with these organizations. We work direct mail, we work with digital, including exciting partnerships with Hiro, but this really keeps patients in their community and encourages them to use the services in their community, and which therefore helps increase revenue to the different organizations. So we're all big one happy family. We want trusted messaging. We want patients to be able to trust the education they're getting. I mentioned this earlier. We know that there is health information all over the internet, and we want to make sure that patients can trust the education that they're getting so that they know then what is the next step I need to take. Do I need to set an appointment? Do I need to get a scan? What does this scan mean? What does my prescription mean? And then engaging them for their both pre and post visit to the facility. if that makes sense.
Yeah, fantastic. And it's actually a perfect segue. So throughout this conversation, we've talked about patient engagement and just throughout the entire care journey, from finding care and scheduling appointments to that proactive outreach and follow-up. But even when patients are engaged, many struggle to understand their symptoms, know where to go for care, or feel confident that they're making the right decision. Health literacy remains one of the biggest barriers to accessing care. Too often, patients either delay treatment, which I'm sure we've all seen, seek care in the wrong setting, or drop out of the journey altogether. And earlier this year, Hyro and WebMD Ignite announced a new partnership that combines Hyro's healthcare trained agentic AI with WebMD Ignite's trusted, clinically validated health content. And our goal was really simple. It's to help patients make more informed decisions and navigate to the right care with confidence. So rather than stopping at an answer, organizations can engage patients in a personalized, clinically validated conversation that helps improve their health literacy, guide them to the appropriate level of care, and help patients take action. So Sindhu, one of the biggest challenges in healthcare is helping patients understand what they should do next. Why does it matter that this guidance is clinically validated and delivered within the health system's own four walls or within their own AI agent? And how does that change the patient experience?
Yeah, so no one's going to be able to tell your patients not to search a condition or go to many of the generative tools available that are available everywhere now. We're not we're not going to get to a point where we're like, don't do that. And that's not, that paternalistic perspective isn't even what we're trying to do. I mean, people are going to search their condition. They are going to look things up, and that's okay. And I think the more important thing is that when they come to the organization, the clinical organization, that we are there to have that conversation openly and honestly about what is appropriate for that individual, because the piece that's usually missing is the person's own history and own environment. That's usually not taken into consideration. And the second piece is that, they're not taking into consideration the organization, resources, tools available to that individual. So, I mean, a whole body scan might be recommended by one of these tools, and that may not be something that is accessible in that moment or even necessary. So having an open and honest conversation is where those searches generally lead. The trick is that you have that relationship built so that that patient comes into the organization or the health system to discuss what they have found using the tools. So it's not that it's not good or bad. It's going to happen. We all do it. I'm sure all of us have done it to some degree, but I think the idea is that we build upon it to give much more grounded, clinically relevant, evidence-based guidance when the questions are asked in the setting of the organization or the health system. I think, like, if you have an agent embedded in the phone line or on a website, or some door into the health system, you're giving that patient another option to kind of research that question, but then we have the ability to offer an action. And I think that that move also kind of allows them to move from generic information obtained from these different tools that are available, to guided information available, to let's act on this information if appropriate. And I think that is hopefully where we start guiding the individuals into clinically validated conversations, clinically appropriate conversations, as opposed to generic searches.
That's great. Amy, I'd love to hear from you. WebMD Ignite has spent years helping patients improve their health literacy. And so what made this partnership a natural fit And where do you see clinically validated content combined with conversational AI helping organizations improve health literacy and guide patients to the appropriate next level of care?
Yeah. I mean, as I mentioned before, everybody's doing, just like Cindy said, everyone's searching, everyone's using AI, and consumers expect to be met where they are. And this is just another tool to meet them, right? And we want to make sure that, just like Cindy had, that not only are they getting the information about their health journey and about their health condition, but it's also driving them to, okay, then what, right? Okay, I can learn all about diabetes or the hip replacement I have to have, but then what? What do I need to do? What is recommended? And partnering with Hiro only makes sense because Hiro's been around. You have this expertise in not only surfacing the right content, but then really driving the next best action. So again, meeting the consumers where they are. Everybody's expecting to engage with some sort of AI. Let's do it really well and then help encourage them to use the services that they're seeking out locally.
Hey, and then T and Eric, hearing what Sindhu and Amy just described as thought leaders in the space, where do you see this partnership or product making the biggest difference for rural health communities and FQHC populations? And then T, we'll start with you.
Sure. I think, to your earlier points that were made, current state, individuals go out, maybe they're Googling, maybe they're using ChatGPT or they're asking questions and they're, Dr. Google, as we've all used that, the term, when you have a solution, and to be perfectly transparent, we don't have the chat functionality live like on the website, but I could see how if your patients become used to the fact that they're interfacing with your health system and they can go to your website and they can speak with Clara and get answers to questions about their health care, maybe I need to see a provider, maybe not. Hiro, the features can funnel you into what's existing today as far as what's built out in the system, right? And so instead of maybe researching outside and then thinking, oh, well, I need to go see a neurologist. And so then, you go in and you make an appointment with a neurologist and then come to find out that was not the right appointment to be made. And then you've got staff time spent reaching out to the patient and trying to get them into the correct specialty maybe. And then, having to cancel the appointment or maybe losing that slot and, losing that access, those sorts of things. And, I could see how it could really be helpful there. And I think really one of the biggest challenges is the difference in technology and the literacy of the patients as it relates to the technology, because you're going to have some patients and some demographics and in some different geographic regions that are less inclined to use technology. And, I think a big piece of this is kind of educating and getting people used to the idea that they can interface and work with this technology and it will help them, but there's going to be a little bit of a learning curve.
Yeah, that's great. And Eric, do you have anything to add to build off of what T just said?
Yeah, just a couple things. Let's be real. We all self-diagnose, right? We all been out there. We've all done it. Now with AI makes it easier. I'll tell you, I still use it to this day as far as helping me diagnose. I don't self-diagnose. It just helps me through the process. But Sindhu made a comment earlier. This tool, once the patient asks the questions and gets the results, the action is the most important part. So whether they need you to go to the ER or to an urgent care or make an appointment with us with the particular appointment type with the provider, that action in itself is the most important part, because this agent RIA, if it's RIA on, because we too do not have this feature yet, but I'm sure Zach want to do it. It's going to be able to provide that action step more importantly. And again, patients trust us, so they'll come to our website and ask the questions to our RIA bot that's on our website before going out to Google's of the world or another AI tool, because they trust us. So the action in itself to be able to generate an appointment is everything for the patient.
Great. And then
Molly-
yes.
Molly, can I just add a comment? Just listening to the others, I just thought of something that has come up in my world, again, given the patient population I take care of, there's this idea that if we're leveraging these tools to answer these questions or to serve up the action that's best, appropriate, that's most appropriate for that individual, that somehow that empathy is being taken away from that interaction. And it's in my opinion, and I really believe this. I think it's actually quite the contrary. I think automation and empathy, there isn't a tension there. They're actually very complementary, because when one of the AI agents, Ria, Clara, can handle a repetitive question or something that's easy, we are respecting the time of that patient too. We're giving time back to that individual, so they're not on hold, so they're not trying to navigate a really difficult IVR system, trying to get a quick answer between, in their 15-minute break that they have at work. And in addition to that, we're also allowing our own teams to have a little bit more time to work through with the patient in front of them on the hard diagnosis, the hard conversation. What's the plan going to be? And so I think empathetic design is what we're seeing come through in the way where these agents are being deployed. And I think that is what I'm hearing when I hear my colleagues speak here. And I just wanted to make sure that point is brought up, because sometimes when we talk about tech, sometimes it feels cold, but it's actually quite the opposite. It's allowing for it's actually allowing us to be more human in some ways.
That is a great point. I know in my own personal experience, the struggle to find time to even make an appointment or ask a follow-up question, it just, it always inevitably falls to the bottom of a priority list. And I've worked in healthcare for years, and I know better, but it just, and so making it easier for patients is, key. All right. So before we open up the floor to questions, I have 3 of my own. So T, can you tell us a bit about lessons learned through your implementation process, or anything that you'd like to share with peers? And then Eric, we'll move to you.
Sure. I'll say, we started in primary care, and then we're starting to move on to our specialties now. So we recently went live with our pediatric clinics. So lessons learned from, that experience so far has been that each specialty is going to have its own fingerprint. They're all going to have their own nuances. The providers are going to have their own nuances on how they'd like to be scheduled with when it comes to the technology and how you're actually setting up the configuration of the technology. Primary care is a different animal altogether as well. So, for me, lessons learned is you need to be patient and thoughtful and look at all of the different use cases and all the different caveats and nuances. And then you've got your technical setup and your Cisco finesse dashboards and all of the things that come into play as you're implementing new technology. And the more thoughtful you are on the front end, the better the go live experience is going to be for your patients. And then kind of feeding into the patient's perspective, this is new to them as well. It's very important to have a robust marketing program, targeted messaging for the patients that see those providers in each of those departments, to let them know what you're doing. We're implementing this new technology that's going to make it easier to work with your provider, et cetera, so that they're not surprised and caught off guard. And then there's still going to be that learning curve. It's going to take them maybe some time to kind of learn how to work with and speak to the AI to get to where you want to go efficiently, and not kind of go around in circles. And so, and to kind of wrap that up in general, I'm focused on a lot of different technical initiatives across a lot of different third-party partners that we work with. And, over the last 12 months, I'm tracking how many appointments are being made online, and I'm starting to see that number increase month over month over month. And I think that tells us something, that's pretty insightful and important. Our patients, they're already embracing digital self-service, right? And so they're really not thinking in channels. They're really thinking in needs. They simply want Tanner Health to be an easy place to do business with. They want to make an appointment, ask questions, refill a prescription, find the right place. And I think our responsibility is to make every one of those entry points feel connected. So to us, Clara really isn't a separate strategy. She's just simply the newest front door into the same Tanner experience regardless. So whether you're reaching us through my chart or a website or by calling Clara, you should have one consistent experience, and that's the digital front door that we're trying to build here at Tanner Health.
That's great.
Yeah, Molly, with a lot of similarities here at Spectrum, what T was stating, but some of the things that I've learned, right? So we have to remember we're training the patient, right? It's a different experience for them. They're used to speaking to someone. They're used to waiting on hold. They're used to all these things, but training them, and I'm so glad T also brought up the marketing aspect. Believe it or not, I am the CIO, but I'm also the chief marketing officer. I don't know how that happened, but that happened, right? So I was able to put those two together and get the word out sooner than later, right? So it's still, again, we're a year into it. We're still growing. It's still changing. But one of the biggest things that I learned through this whole process is, I don't know if this is a good thing or a bad thing. You'd always say you walk before you run. I run before I walk. So a lot of times, like, I want to move faster, but in reality, you have to take your time with these type of things because you want to make it right, because the first experience for a patient is everything. If they have a bad experience, you could potentially lose that patient, right? And so the biggest thing for me was just to really take my time through this. Yeah, it's been a good year, but it's better that than, again, give the experience a bad one back to the patient.
I love that you both touched on change management and marketing to patients as someone who works in marketing. So important. So thank you for bringing that up. Let's talk about measuring success. So for both of you, what does success look like for your organization? And what metrics are you tracking? Eric, can we start with you?
Yeah, so I know we're getting close to time. I do see the numbers. I look at the conversations every day. Believe it or not, it's crazy how much I look into it. But I'm seeing the completion rate. I'm seeing that 70%, 71, 72% of what Ria is actually completing on her own. She's going to actually, those numbers are going to start to grow when she actually does her own appointments, new appointments for that matter. So we want to be able to see that. We're really big on customer service satisfaction because our regulations by HRSA, we have to do certain things. We have to submit for our patient-centered medical home status to here's our satisfaction. What was the access? What did we give back to the patient? So all these things that we're doing from an implementation of Hyro is giving us those positive results, and we're seeing it. We're growing from it, and then we'll get some questions about or some comments that I didn't like this or like that. We take that back, we learn from it, and we make those adjustments for the patient so they know that we're listening. More importantly,
That's great. T, what about you? How do you measure success? What does it look like for you?
Yeah, so looking at a lot of the same things Eric is here, but also look at how much quantifiable time are we saving for our teams, right? And so if we're able to pass along a patient phone call to our call center and provide context, what does that mean? Our individuals, they're going to be able to answer the phone. They're not going to have to ask the patient why they're calling. The patient's going to be able to not have to answer all those questions again. It saves time, and it makes the patient feel like, well, I've spent time telling the AI this information, and now I'm going to answer the same questions again. It reduces those frustrations, and what's interesting is it can also tell intent. So I remember when we went live with our first practice, we were kind of in a little go live bunker room located in the clinic, and one of the staff members came in, and I wish we could have recorded it because she said they were so excited. Clara just let us know that Mrs. Jones was calling, and it even told us that she was in a bad mood. And so she was like, I was able to answer the phone and say, hey, I understand you're having some difficulty, Mrs. Jones. How can I help you? And immediately disarm the patient and make them feel heard and understood. And the technology was at the very start of that. Now, high level, we're looking at, all the things everyone looks at: access improvement, appointment completion ratings, reduce call burden, no-show reduction and those sorts of things. So, really excited about some of the preliminary results, and we'll keep hope to keep seeing those numbers increase and patient satisfaction increase as well.
Yeah, that's great. And then finally, before we get to our audience questions, and just a reminder to the audience, please start putting your questions in the chat so that way we can go through them with the remaining time that we have left. What advice do you have for peers, those navigating similar challenges? T, let's start with you.
What advice do I have for my peers? Well, I'll say, the world of modern healthcare is infinitely complex and complicated. And then you couple that with technology and all of the new advancements in the world we live in today. And it can be a very confusing and dizzying type of experience, because you've got lots of different problems operationally that you're trying to solve or improve. And you've got lots of different solutions, coming at you from all these different directions. And I guess my advice would just be to slow down, to move faster. You really need to stop and think about what are the priorities here. Where are we having the most friction, with our patients, or whether that be with, the workflow or the technology or what it may be, and determine, what is the priority here, and how are we going to, kind of attack that, and find a solution that works, or find a change in workflow that makes things smoother and makes the patient experience better, and those sorts of things. And so that would be my advice, is just, don't rush into it. Try to learn from other people's mistakes. That's one of my favorite things. I love to learn from other people's mistakes. So work with your other peers in other organizations in the United States and across the world. How have you done this in other places? Instead of me trying to reinvent the wheel to figure out how to do this, I know someone else has dealt with these same issues. Let's try to find somebody that we can talk to and figure out how they manage that problem, or solve that problem, or reached a solution, instead of spinning our wheels and trying to cobble something together from scratch. Let's work smarter and not harder.
So Molly, let me just add. So T pretty much answered my question. I had my notes as he was talking, and I'm slashing them off as I'm going along. It's really about just making sure you're asking the right questions. And we live with many. I have a new priority every day. I really do, and it's drives you a little crazy sometimes. But in reality, what is it? What's the problem we're trying to solve? And in this case, for Hiro, we're trying to solve that solution for the patient to be able to have access, to be able to get to us at any point, any time, and we're seeing results, and that's the most important thing. But again, ask the right questions. Ask your counterparts. We have other FQHCs in this area, and they're reaching out to me to ask me about this technology and what are my. And that's the whole benefit. You need to ask the right questions. Initially, it's funny, before we did this whole implementation, I put myself out there. I presented this to my CEO, and she was all, this is great. And I'm thinking back in mind, oh my God, hopefully I made the right decision. And I'm glad I did, right? I'm glad I did, because it is a game changer. And if you're afraid of technology and not willing to take that extra step, you're going to fall behind for sure. So my advice to people, you take that chance, but ask the right questions and ask the folks that you do trust to be able to give you the right responses.
Yeah. Can I, just one other thing I want to add, I don't look at AI as something that replaces the human and the human connection. The human stays in the loop. Yep. I look at these new emerging technologies as something that can benefit and augment our staff's ability to do the work that a person needs to do, and make the decisions, and be the human in the loop, and not take away the empathy or the emotion or the connection with the patient. Just provide additional tools to make it better.
While we're still waiting for folks to ask their questions in the chat, I hope you don't mind. I have one of my own now. So I think, a lot of folks who are in the FQHC or rural health space have, smaller teams, already tight bandwidth. Is there a cost to not acting sooner? I think, the idea of implementing a new technology can be daunting. What are your thoughts on the do I, don't I, knowing that bandwidth, that you need bandwidth on the team to help support any type of implementation process?
So Molly, just for myself, when we went through this implementation of Hiro, resources not having enough. So I think that's probably one of the reasons why it took us a little longer, with myself and another person on operations really doing a lot of the testing and so forth. So, we learned that because of not having enough resources, we could have implemented this sooner. But at the same time, by not implementing specific technologies, again, such as Hyro, you run the risk of, again, patients leaving you, right? And we depend on every single patient that walks in this door. We are measured by the unique patients who walk into us every year. That's how we get our grant funding. So we have to give them the ability to have that control, to be able to use the technology to help them benefit their overall experience.
That's great. T, would you say that, you face the same challenges when, evaluating or considering Hyro as a partner?
I'll say for us, it's, there's no one size fits all solution, right? And a lot of, we're a smaller, nonprofit community health system, and we're not as big as these huge mega health systems that have lots of resources and lots of staffing and all of those sorts of things. Our medical group, we don't have centralized scheduling. We don't have centralized referral coordination. Those are managed at the practice level. And we don't have the same technology stack in our rural health centers as we do, in some of our larger, more urban areas in those practices. And so when we were evaluating, we're looking at, well, are we gonna build an entire centralized scheduling team and staff a building, and what's that going to cost, right? Or can you find and implement a technical solution that kind of fits us, that thumbprint that I was talking about, how unique each of the practices are, and can help to kind of unify the experience for the patient, and how they're interfacing, and part of how they're interfacing and working with the health system. And you've got a clinic, they have no Cisco finesse. Hyro, it still works for them. There are some limitations. You may lose some of the functionality, like the context aware and those sorts of things. But I think for me, ultimately, it was looking for a solution that could work across all of the 40 plus locations and the different specialties and all the nuances, without having to completely rebuild our structure and put a new team in place here, and all of those sorts of things. It's quicker, easier to implement than doing something like that. And so far, it's been a positive experience for sure.
That's great. We have a question from the audience. Were either of your organizations able to leverage the Rural Health Transformation Program funding to support your investments in patient access and engagement innovation?
So I'll say, well, we're in a unique, because we have a footprint in West Georgia as well as East Alabama. So we had the opportunity to apply for both Alabama and Georgia RHTP. I'd requested funding to support some staffing models as it relates to supporting chronic conditions in patients, diabetes education, different kinds of nutrition therapy, nutrition therapists, community health advocates, different positions like that, which, they're focused on not, we're doing these health-related social needs screenings, SDOH. They changed the acronym on me, so I'm a little, always get confused there. But, that we ask all these questions, and do you have needs in these certain domains, food insecurity, et cetera, but how do you close the loop? And so some of the funding we had in our request had been for a community health advocate, which is an individual that actually closes the loop, communicates with the patient, and connects them with resources in the community. As far as it relates to technology, there were some requests that we made for some connectivity, some equipment that we needed, some telehealth devices, some ways that we could have the patient be able to do remote visits with specialists that are in Georgia, but the patients in Alabama, and those sorts of things. And so again, looking at different technologies to implement to help these patients that maybe they live in an area where they have no cell phone service, maybe they don't have a smartphone. It's hard for them to get transportation. Our community health advocate can help you get to the appointment or get to the telemedicine pod that we set up so that you can communicate with your neurologist in Georgia and those sorts of things. So yeah, to answer your question, we we have some of that baked in, but I have not heard the outcome of the submissions yet. I'm hopeful though.
All right. Well, thank you so much. We're at time, but this has been such a fantastic conversation. T, Eric, Sindhu, Amy, thank you so much again. And with that, I will close the webinar. If you have any questions, please feel free to follow up, and I can try to pin down our busy panelists to get those answered for you all. But thank you again, and have a great rest of your day. All right, take care, everybody.
Thank
It's
you.
been a pleasure. Thank you.
Yeah,
Thank you.
All right. Bye-bye.